Hi, it's Dr. Jenny and Dr. Daniel from Spinal Corrective Center in Amherst, New Hampshire, and we're joined by our patient Sherry, who's going to help us demonstrate a certain type of neck adjustment that's a cornerstone of our practice. It's called an upper cervical toggle recoil adjustment. And we thought we would share it with you because so many people have this idea or fear that the only way to have your neck worked on is some type of twist or popping noise. And it can be scary. And oftentimes people will ask us, is there a way to adjust me without feeling like I'm going to have my neck twisted? And you know, sometimes there's some really great techniques that do involve some type of rotation in the neck. But the cornerstone of what we do is an adjustment that doesn't involve that at all. In fact, this adjustment is a very powerful way to increase your energy, increase the function of your immune system, and help your whole body work better.
And I mean, you said it's a cornerstone of our practice. It's also just a cornerstone of the chiropractic profession. And B.J. Palmer, the man who really developed chiropractic, he specialized and focused on that adjustment solely. And he even gave this huge speech of moving the profession toward this one adjustment. Because if you think about it, your brain is up there in your head, obviously near your neck, and the brainstem comes out through that area. And many key functions of your body, like breathing and heart rate, are controlled in that area. So if you have a misalignment of your upper cervical, then it could cause problems throughout the entire body.
Yeah, in fact, you know, people will say you'll have a low back problem with some type of nerve pain down their leg, and I'll explain. I adjust the whole spine because the nerve that eventually comes out the back and goes down the leg has to first come through the neck to get down the back to go down the leg. So working on any interference or stress in the entire spine is how we help the whole body work better.
And it's funny you should mention that because one of the first patients that I ever worked on in clinic back in my chiropractic school had low back pain. That's why he came into me. It was really bad low back pain that prevented him from functioning at all. He could barely stand up straight. And so I went to see him, I analyzed him, and I wanted to take an x-ray of his low back, but I couldn't because our x-ray machine was down at the time. So I did have an x-ray of his neck, and I was like, you know, I'm going to adjust his upper cervical area. It was subluxated, it was out, and see what happens. So I adjusted the subluxation in his upper cervical area. He comes in the next visit and he says, I don't know what you did to me, but my low back is feeling so much better. So that was just a great experience, great reminder to me of how that area can affect anything in the body.
So I'll demonstrate it. We use what's called a Thompson Table. So what's unique about Thompson is there's levers that will bring the table up, and let your head just rest. You're going to see and hear the table shift down. So this time I'm going to bring it up, and you'll watch me use this part of my hand, and I'll stabilize it. I'm going to stand in front of the patient. I've already evaluated her. I know exactly what she needs. How'd that feel, Sherry?
Always good.
Always good. Obviously, the table makes a noise, but the patient really feels no discomfort. It's a pretty powerful technique. Be well, everybody.